Welcome to the Making a Multi-Million-Dollar Med Spa podcast, where we dive into the art and science of building a thriving med spa. I'm your host, Kat Toronto. In this podcast, we're all about empowering medical professionals and entrepreneurs like you with the knowledge, tools, and inspiration needed to elevate your practice to new heights. Whether you're just starting your journey or you're a seasoned expert looking to expand, this is the place where the industry's brightest minds come together to share their secrets to success. So sit back, relax, and get ready to unlock the potential of your med spa with the Making a Multi-Million-Dollar Med Spa podcast. Let's go on this journey together, one success story at a time. Welcome back to the Making of a Multi-Million-Dollar Med Spa podcast. And today I have with me one of my all-time favorite people, Dr. Amy Carter. Thank you so much for joining me today, Amy. I really, truly appreciate it.
Thanks for having me.
Yes.
I'm excited.
And we're also talking about one of my new favorite topics. I guess favorite's just a word I'm going to use a lot today, so get over it. But we're going to talk about, well, one, your journey, because I think it's such a beautiful journey to share. And then also, we're going to talk a lot about wellness, because it's something that you've launched with us here at Aesthetic Care. And so just sharing your experience and all of the pearls and all the things that you've done along the way, I think is so beneficial to so many people, not only our patients, of course, your patients, but to clients, mint clients who are looking to add wellness, whether it's weight loss or bioidentical hormones. We could talk about both, and there's some things outside that with IV therapy and things like that, how you see the future coming, but just your experience with that. And for those that are thinking about getting started, maybe where to start, maybe
sure,
and then after that, where to go. So we're gonna come back to that, but I want to take a step back and just share a little bit about your history. And this wasn't on my potential questions, but I'm going to ask it. Like maybe a little bit about your childhood. Like what made you want to go into medicine? Because there's just so much dedication that gets a person to that point. So, what took you to that? And then why you chose the path of medicine you did. Let's start with that.
Perfect. So I'm a private practice OBGYN. I started in 2007 going into private practice, and I never, ever imagined I would be an OBGYN as a child growing up. So my father was an orthopedic surgeon, and I loved going to the hospital and rounding with him. And so I used to see these little old ladies with hip fractures, or I'd sit on the sidelines of the Mizzou basketball games in Columbia while he helped with the team. I also would sit on the sidelines of like the high school football games when he would help with sports injuries. And so I went to college and decided to do finance because I didn't want to do medicine, because I thought it was just because I liked my dad. And so
I was going to say, when you were a kid, what did you want to be? What did you want to be when you grew up?
I wanted to be a doctor when I was a kid.
Okay.
But then as I got older, I thought, is that just because I like my dad? And I loved finance too. I loved business and finance, and so I started out in finance, and then realized in the middle of my sophomore year that I really did want to do medicine. And so I kind of changed courses and took a bunch of chemistry and biology classes.
Good thing you figured it out as a sophomore, not a senior.
Exactly. That's exactly right.
I mean, you could still done it, but it
it had taken me a little longer.
Yeah, a little bit more effective.
Yes.
So, all right. So you didn't, when you chose medicine, what then took you down the path to be an OBGYN?
So I grew up watching quite a few surgeries too, and I knew I loved surgery, but what I also knew I loved was continuity with patients. And I felt like some of the surgical subspecialties didn't have quite as much continuity as I liked. And so I loved developing those relationships. I loved procedures. And then when I was in medical school, I really loved delivering babies also. So I got to do both. I got to do all of it. I got to do surgery. I got to see people back in the office year after year. And then I also got to deliver babies, which was a lot of fun too.
So that you started your practice in 2007.
Private practice,
And so, but you've gone from OBGYN to then starting an aesthetic practice to then wellness. And so what happened with that turn of events to add aesthetics to your private practice?
So I loved private practice OBGYN, but in just talking with patients, I felt like it was like a perfect complement. I had lots of patients that would ask me where to go, who to see, what to do. You just talk a lot with patients. I think being an OBGYN, you talk about a lot of private things, and you
like every private thing
and you get to know people pretty well, and they trust you. If they trust you operating on them, if they trust you delivering their babies,
Absolutely.
If they trust you seeing all their private parts, then they tend to listen to you, and they tend to ask your opinion about things in medicine that maybe not all patients ask other doctors. And so I just felt like it was plus I was starting to get old and looking in the mirror and thinking, there is more, there is more to this whole wellness, and aesthetics are really fun and interesting, and it's something that sometimes is a little lighter. It's a different focus. And so my dream was kind of to have like a one-stop shop for women eventually. And then I started also seeing husbands and boyfriends and male family members, which has been a really fun journey also. But that's how I kind of got into it, wanting to kind of do the whole thing.
Do you know an outstanding med spa, doctor, manager, provider, or groundbreaking treatment that is reshaping the industry? Nominate them for Men's Clinics to Watch. We are so excited to launch this initiative to recognize the true leaders in our industry. Our aim is to spotlight those leading the way to excellence, providing valuable insights for others to pave their path to success. Check out our website for past winners of the Clinics to Watch. You can also nominate someone at the link in our show notes. Share your nominations and be part of celebrating the industry leaders. Let's inspire and build success together. Our flagship training event is back for another year. Join Mint Aesthetics for our virtual immersion seminar on June 14th, September 6th, or December 6th, or all three, for a day-long comprehensive training on BBL and Halo. We will cover an in-depth didactic with insights on settings, contraindications, post-care, and more. Plus, we will close out the day with hands-on combination treatment demonstrations. For only $5.99, you can get the best BBL Halo training for your entire team. You also have the option to pay with Sciton Success Builder points. Registration is now open for all dates, so book your spot now. Well, I can't imagine. I mean, I look at myself even, and truly, like, there is no physician you trust more than your OBGYN that takes care of not only you, but your baby.
Right,
I mean, that's so true.
Mm-hmm.
And to see so many women go through that, where you feel like you lose yourself, you lose you lose your body, which sometimes kind of feels like you lose yourself.
Yeah,
and
you totally can.
And I remember thinking, man, I have 3 sisters who have had lots of babies, and they didn't tell me any of this crap.
Right,
right. I mean, like,
you learn lots.
Why not? Why hasn't anybody told me what's going to happen to my body?
To your body, yeah.
Yes.
Yeah.
And you know what? Probably a part of it is also I wasn't listening because it hadn't happened to me yet. It's kind of like just the things that they were probably saying. I was like, oh, yeah, that's happened to you, but it's probably not going to happen to me. And then, of course, it happens.
Well, and how much do you want to worry about it ahead of time?
Well, true.
Some things I think are really educational and helpful, and then other things it's kind of like, well, that might happen or it might not. And
right. Well, that's true. And I think most of us, too, are just so focused on a healthy baby.
Yes,
that's like
the most important.
Right. And so,
but looking back,
but then once that healthy baby's there, and a few months go by, and you're like, oh, I can't get into my jeans yet.
Yes, what's going on here?
Yeah, I'll never forget my older sister. She had her first pretty young, in her early 20s, and I'll never forget. She took her pre-pregnancy jeans to the hospital to go home in. Like, she literally thought she was going to have that baby and just jump right back into those jeans. And we still laugh about it today. Mm-hmm. But I do think that those patients of yours, or those of us, all of us that have had babies, I mean, aesthetics is such a beautiful option because there are so many things, especially now, way more than 5, 10, especially 15 years ago, that we can do for women, after they've had the baby and their hormones are balanced, and it's the right timing for them, of course. But with lasers and injectables, and there's so many things we can do for them. It's so fun.
It is so fun.
Yeah, I love it. I remember, I was like, okay, I had Jax. Can I have my Botox? Like,
yes. When can I have it? How soon?
I'm like, I get it.
Can I do it while I'm nursing? Can I not do it while I'm nursing? All the things.
Yep, all those things. So it is such a beautiful marriage between what you were doing and where you've taken it.
The weight loss, the tightening.
Yes.
Yeah. Getting rid of the melasma.
Yeah. Oh my gosh, I know. Okay, well, so before we jump into the wellness piece, with your previous experience and all the things that women go through during pregnancy, what are some of your favorite treatments to talk to those women about, whether it's, if you want to talk about melasma or something for their body, or, what are the top treatments that you feel like get brought up the most with that client base, like post-babies?
I think post-babies, certainly neurotoxins are always key post-babies. Everybody loves a good neurotoxin, right? Botox,
instant gratification.
Yes,
you look like you've slept that you haven't.
Yes. And then I think the brightening, I think BBL, you have to be a little bit careful depending on when you start it. And BBL with melasma can be a little challenging also, but I think brightening with BBL is great. I think Halo and Moxie are great treatments post-baby, not too far after post-baby. And then I think just depending on the person, I think there are some good skin tightening procedures, but, and some people don't need, a genius right away and don't need some of the other, in Diva. And so it just kind of depends on the person. Combining weight loss and cool sculpting for some women that can't get the weight off soon, are great treatments too. So they're all really good treatments. It just depends on what the post-baby mom needs.
Yeah, that makes sense. Well, since we're talking about all of that, because I also know that you have Diva and Emsella, what do you think of those two devices independently and then together? Any thoughts on that?
I think they're great procedures. I love Diva for all ages of women. I think it's great post-baby. I think it's great for the perimenopausal or early postmenopausal female. I think it's great for women who can't do hormone therapy. I think it's a great adjunct for women already on hormone therapy, but for women who've had breast cancer or can't do hormone therapy, it's a great addition for vaginal dryness and sexual function. And I think Emsella is fantastic. I love women to go to pelvic floor physical therapy with a physical therapist, and I think Emsella does similar things with strengthening the pelvic floor and increasing or helping sexual function. So those two paired together are fantastic.
And so when you do a combination or a package like that, so one, Diva is a device made by Cyton. It's a fractional laser technology. So for those of you that have Halo, similar, the same wavelengths, but delivered differently. And so with Diva, what's the downtime of Diva?
2 to 3 days.
2 to 3 days.
As far as sexual functioning, there's really no downtime. You can have, a little bit of abnormal discharge and a little bit of stinging, urinating. You may not want to do intense exercise for a day or two, but there's really no absolute downtime except no sex for 2 to 3 days.
Some women aren't going to be able to go for that. I just think like with Diva, that was one of my biggest surprises when I had the treatment, because I thought, oh, Halo's so hot on the face. Like this downtime is it going to be bearable? And I had it and I was like, oh, that's it? That's like the easiest treatment ever. The treatment itself is less than 6 minutes if you're doing 2 passes.
Right.
And the most of it, you really feel nothing other than like the maybe the last third part of the treatment.
Right.
So maybe a minute of each pass, something like that. And then the downtime, I thought, oh, wow. I'm not hot.
Right.
Like you are with something like Halo. So
right.
I was very surprised at how easy the treatment experience is for our clients during it as well as after.
definitely less uncomfortable than Halo for most people.
Yeah.
Definitely less.
And then Emcella is a BTL product. Do you want to talk a little bit about how that works?
So it's an electromagnetic device that delivers electromagnetic pulses to the pelvic floor to improve sexual function, strengthen orgasms, and decrease incontinence, like leaking when you cough and sneeze. That's mostly what it does.
I'm going to look at you and say this for probably the 100th time since I've known you. Why am I not doing that every day?
Exactly.
It's ridiculous. Every time we talk about it, I mean, don't get me wrong, I have done it, but it's something that I feel like could easily be done on a regular basis. I could take things in there and like that.
Do your work.
Yeah.
Yes.
And
we should be doing that.
Right.
Yes. And you can do it, once or usually eight treatments, but once or twice a week. A lot of people do once a week. You can do every other week, but once a week. A few weeks.
And so if you were to do a package of Diva and Emcella, what would that look like? Well, you've kind of talked about that already, but how many, how often?
Often. So sometimes post-baby, people will just do 1 or 2 Divas, but typically for perimenopausal or postmenopausal women, we'll do 3, possibly 4 treatments. And typically we do Divas 4 to 6 weeks apart. Mm-hmm. And so if you want to do Emcella at the same time, they're great to be paired together, but you would get, a few Emcella treatments in by the time you do your second Diva treatment. Mm-hmm. And so by the time you do your third Diva treatment, you'd have all your Emcellas in. And then typically, and everybody does this a little bit differently, but some people will do then, once a month, 1 Emcella treatment once a month. Some people will do like once a quarter. Mm-hmm. So I think that's the most common way to do it, is either once a month or once a quarter, to have an extra treatment to kind of keep up on the pelvic floor.
And when you look at other treatments or medications or surgeries that would give you the result that you can get with Diva plus Emcella, I mean, what is it competing against?
Yes, for incontinence, as far as the Emcella and the Diva, you're looking at either medication or continued regular pelvic floor physical therapy, either with a therapist or doing your exercises every day on your own at home, which always should be continued, even if you're on, even Kegel exercises if you're doing Emcella. But sometimes it's easy to get out of the habit of that. So, or surgery for incontinence or medication. And surgery is necessary for the more extreme cases, but a lot of times with exercise, muscular, whether it's the Emcella or physical therapy, and then Diva, you can do it you can do it just with those without going under the knife.
I mean, I just want to get the word out there. Yeah. I just want women to know there's an
less
option.
Invasive options
and it
that
works.
are easy to do. It works
you
well.
go to a clinic with the right.
Yes.
We're not over-promising.
Right.
We don't want to under-deliver. Like we're treating the appropriate patients with it. And I think it can make such an impact on someone's life. I just wish I could get out and scream it from the rooftop, and more people would hear, so that we could help those women.
Yeah, it makes a huge difference for people. And like you said, it's great to say that. We don't want to overpromise and underdeliver. And I always tell people, everyone gets, there's not one person, or not everyone gets the exact same results.
Sure.
Some people get better sexual functioning and their incontinence improves a little, but it doesn't improve 100%. But I've never had a patient that didn't say it didn't help with 1 or 2 of the 4 things that it does.
Isn't that amazing?
Yeah, it is amazing.
Especially because with that type of procedure, we don't have a before and after photo.
Right.
I mean, you can't say oh, your brown spot was there and now it's gone.
Right.
Your wrinkle is, we don't have that. And so I think it's pretty amazing that they come in and you get that feedback. That each person that has been treated has had a result, and it's going to vary.
Right.
But there's always results.
I
mean, that's amazing.
Yeah. And the tissue just looks healthier when you're doing the Diva. The tissue just looks better afterwards. Especially for the perimenopausal, postmenopausal women.
I mean, and too, it's something that you see every single day so many times, but as your patient, I was just thinking, how could I get a picture of that? You know,
Right.
It would be
Yeah.
good for it'd be good for them to see. So maybe there's like some sort of little handpiece that could connect onto the Diva handpiece. It's like little photo,
This is what it looks
treat,
like.
photo,
Yeah,
and then
yeah,
something like
yeah,
that. I don't
yeah,
know. There you go,
absolutely.
Saitan. There's a little idea for you. Some way to capture that, because the results. It's so important to be able to really gauge that result for us to have confidence, our team to have confidence, and of
in
course
what they're doing.
and our clients. So I love that. So I mean, I think we started in aesthetics, but really all those lasers. I mean, they dropped us right into wellness or the wellness topic,
Right.
And so for me personally, getting exposure in the wellness world, one part of it started 10 to 15 years ago when I lived in Arizona. And there it was, bioidentical hormones were being talked about all the time, and IV therapy had already come out. And so when I moved to Kansas City, I would look at Matt and say, like, where is all this stuff? Like, I just don't see it yet. And so I think, now here we are, not only is it like hit Kansas City, but it's also totally different than it was 10 years ago nationwide. I mean, there's just so much that's come out, so many changes that have happened. And so, but the piece that I was really introduced to was Diva. That was the first time that I was exposed to it, because we had technology, and I got to hear all these women's stories that you've been hearing every day of your career. But I had not heard, like, they're not going to tell us that when they're coming in for a BBL treatment on their face, that they're having painful sex and they, all of those things. And so it really opened my eyes and my heart to it. And I thought, oh man, how can we do a better job of helping women? So I think it's such a beautiful thing to be part of. So thank you for bringing it all together for us. At Mint Aesthetics, we are huge believers in the idea from Richard Branson. Train your team so well that they could work anywhere, but treat them so well they never want to leave. That's why our hands-on training programs in Kansas City have grown to be so successful. We pour our hearts into the trainings we lead, so your team feels confident and capable when they walk out those doors. We offer business consulting so your management team can see and feel the culture of our team firsthand. Our goal is to provide exceptional insight and expertise for your team to take home to your own clinic. Book your private, in-person training, business or clinical, with Mint today. You can find more information at the link in our show notes. We found the perfect trio: virtual, quick, and free. Mint is hosting 1-hour clinical trainings for eCourse subscribers on the first Tuesday of each month at 2:30 p.m. Central Time. We will be covering clinical topics like Sculptra, Genius, BBL, and Hydrofacial. Check out the link below in our show notes to learn more. Okay, so looking at the laser piece and moving into what I'm going to say, well, I shouldn't say wellness, but let's start with weight loss, because that's been something that's on everyone's mind lately. What made you think, okay, we got to get into this, and then how has it been going?
So I've been doing weight loss in private practice for a long, long time. I feel like with every patient, you talk about diet and exercise, and and really in private practice we just don't have a lot of time. We don't have enough time to really go into details with women about their journey and their weight loss. And it's such a food and weight loss and how we each see our own bodies is really complicated. And for a lot of women, it's hard to talk. For a lot of women, it's easy to talk about, but for other women, it's hard to talk about. And there's a lot of stigma attached to it. And as a provider, it's always a challenge knowing what will make a difference to the person that I'm talking to. You don't want to be, you don't want a doctor that just, or a nurse practitioner that just says, well, you need to lose 30 pounds, go figure it out, and that it doesn't feel right, not spending the time to figure out, what are the struggles? Are the struggles, all their stress at work, they're working too much, so they don't take time to meal plan. Or, there are just so many, it's just so complicated. It's just not simple. And so I think I've really enjoyed doing this more at the wellness center, because you can dive into that history a little bit more, and you can kind of figure out, and I always tell patients, you know yourself better than I know you. And so, this is kind of something we're going to do together to figure out what your struggles are. We have lots of great tools. We can talk to you about lots of great things as far as, intermittent fasting and medications and what you should be eating and what, nutraceuticals you should be taking. And there's so many great tools, but really women and men are the best tools, in kind of talking about and analyzing what their own struggle is. But we started getting more into the weight loss. I mean, I've done medications with weight loss for a long time, but the new, the GLP drugs like semaglutide, Wegovy, which are the same, Ozempic, and then Mounjaro or tirzepatide are the hot new drugs on the market that have made a tremendous difference in a lot of people's lives. They're not perfect. Every medication can have side effects. They get a lot of bad press in the media, but they also get a lot of good press. And so, but they are game changers in the weight loss world.
Yeah, well, we'd had a little conversation before the podcast because I was sharing something with you, and I want to share it again because this last week I got an IV with an IV clinic. We're setting that up right now, soon to have that, but currently we don't have it. And so I'd gotten this IV, and I was talking to the nurse about weight loss meds, and she'd made this comment to me. She's like, "Oh, do you think this is going to be a good thing? What are we going to find out in 5 years and 10 years?" And I said, "Well, I'm not a doctor, so I'm not the person that has all this information. But what I would tell you is that in our clinic, what we have seen so far are miracles with so many of our patients." And I say miracle, and I don't say that easily. I mean, it's like, but truly miracles. And I was telling you a friend of mine, had gone through an experience with a weight loss medication, and she'd been a smoker for 20 years, and she just quit smoking. And so, I think that alone, not only did she lose the pounds that she was looking to lose, but her whole life has changed. And I'm not saying that's going to happen for everybody. I'm not putting that out there, but I just think that's amazing what that has done for her. And so her story that she was telling me was that she has a patient in her IV therapy business or clinic that had been given the wrong dose. So the dose that she normally got was not available, and so she was given 5 times her dose and had a horrible experience all night. And so I was telling you this, and you were like, "Well, it was 5 times the dose."
No one should get 5 times the recommended dose.
Right. So I'm like,
that's going to cause problems.
Yeah, right. Oh.
So it's not the drug.
It's not the drug.
It's the 5 times the dose.
Right. But that's a story that's out there. And
right.
I thought, how is this the story that's being talked about and not the story of so many people at our clinic? And then aside from that, personal friends that have told me about things. But these amazing things that are happening between whether it's the addiction or just, the weight loss alone, and how it can have an impact on not just their weight, but also
your heart, your lipid profile, reducing the risk of diabetes or improving your hemoglobin A1C so that your blood sugars are lower, so that your nerves and your kidneys and your heart and your all the organs in your body aren't negatively affected. It makes a huge, huge difference.
And so what do you see, to go back to maybe what some of the downsides would be, what are some of the downsides? And what's negative, truly what you think is like a downside, or what we hear in the media would be the negative part of this?
Yeah, so I think, with the weight loss drugs, they certainly can have side effects such as pancreatitis, which can be a life-threatening issue with inflammation of your pancreas. That is few and far between, but it can happen. And if people are having significant abdominal pain, they certainly need to notify their provider, their physician, to have that looked into. And so I think it's very, very, very important to just make sure that people's labs are being followed and that they're being followed on a regular basis and that they're educated on what side effects can happen and to notify us or to notify their provider if they're having any of those side effects. We certainly, the weight loss is amazing, and some people want to lose weight so bad they'll overlook some of the side effects, and that's why I always think it's important for the first at least couple months or few months that we see them back on a regular basis to make sure that we ask, because some people, will think, oh, this is, this side effect is because of something else, and they'll kind of ignore it. So pancreatitis is one significant side effect. Delayed gastric emptying can be another one where they have issues. I mean, you can have reflux, heartburn, constipation, diarrhea, nausea. Most people have very mild side effects. Most people have some mild nausea, may not feel hungry at all around the time they take the shot, or may get some heartburn if they tend to get heartburn. That's the most common side effects. We do want people's appetite to be a little bit suppressed. And as long as people are losing weight with that, then people don't need high levels of the drug. There's some people really resistant to weight loss, and they may need higher levels of the drug. Definitely, the side effect profiles are higher, and the risks are higher in diabetics and people who have a lot more weight to lose and are on a lot higher doses of the medication. Those are typically when we can see issues. But the vast majority of people don't have significant issues, don't have significant side effects or reasons why we have to stop the medication.
And so compared to what you were using before, all of these years offering weight loss and this type of drug, how are you comparing or feeling, or the differences between?
I mean, it's a definite game changer. I mean, we do still use phentermine, which is a stimulant, and that can, make people's blood pressure higher. It can cause dry mouth. And so it's a great drug. It can also be habit forming. It's a controlled substance, so we have to kind of watch for it. So there are great things about the drug, and then there are things that we have to watch with it. We have to monitor people closely, regularly with it. So it's a good way to lose weight, but the GLP-1s like semaglutide and tirzepatide, I think people have been more successful with them. And sometimes we stack drugs on top of each other too, and we'll do multiple drugs. But the GLP-1s, I think they're here to stay.
Yeah. I've just seen so many people so happy that I think, oh gosh, I know that there's going to be side effects. I know there's going to be unfortunate situations out there like this woman who took 5 times her dose. But if you are working with a physician or a clinic that is monitoring you,
right,
it's not likely to happen, a lot of these things.
Right.
And so there are, from what I hear in my area, some clinics don't do labs at all.
Right. There are some people who don't do any labs. Yeah. There's some people who don't monitor vitals, have people back regularly, or do any labs. And some people self-titrate their doses at home, which I think is not a great idea. Yeah. They'll self-titrate up to when they just don't feel hungry anymore. Over time.
Okay.
Yeah.
Okay.
And if people have been on the drug a long time and they've been established with a physician, and the physician knows the patient and knows that they're educated on what the side effects are, there may be some cases where that's totally appropriate.
I'm such a rule follower. I'm like, what? I like my plan.
Yeah, it's so important to make sure patients are educated well and that know that they have follow-up and that they know what to look for so that they can call. That's really, really important.
Well, and, of course, I think I have a lot of people that reach out to me because, they'll say like, oh, hey, I'm on it. Maybe they don't live here in Kansas City, so they can't come to us. And, and I'll ask, oh, hey, did they get your labs? Are they following up with you? Oh, no, they didn't even bring anything up. It's like, let's find you another clinic.
Right.
Right?
There are great clinics that will follow you appropriately.
Yes, so it's like something that in the consultation, and I know this podcast is, geared towards other clinics. But if it were geared towards the consumer, you would want to say, go to a clinic.
Yes.
That
educates you well, that does labs, that's looking at your whole history. Because there are things that if you have a history of medullary thyroid cancer in you or your family, that you can't be on it. There are things that we want to make sure there's a good history taken to avoid some problems.
Definitely. Okay, so a couple things have come up in this chat. I just wanted to just tick back to you here for a second. And the first is you'd mentioned earlier in your career that, actually going into wellness, that as an OBGYN, you didn't have a lot of time to really dive into history and helping with weight loss because you're given, I don't know how many minutes.
Just a few minutes.
A few minutes, to see them. Mm-hmm. And so how do you dive into something when they're coming to you for something totally different if you don't have the time to do it in this insurance-based model?
Right.
And so being able to come to the wellness clinic, which is no insurance, it's cash-based. Cash pay. And so you can take more time because you're charging for a consultation, and so there's more time that can be spent, and that's kind of the whole idea behind it, is that now you have the time.
Right. Correct.
And so I think it's an important piece to focus on, is that this wellness piece, the weight loss that you're currently doing at AC Wellness, is cash pay.
Right. Correct. Yes.
And how is that going?
It's going well.
Okay.
We're busy.
Different
we typically do a two-part consultation. So we have people in, we take their history, and then we send them out for labs, and then we have them back, go through all their labs with them, go through their history again, and then make recommendations.
Okay, I love that. And then you'd mentioned nutraceuticals earlier. And, kind of looking at that part of the business, what do you love to have at the clinic? And maybe if it's something that we currently have, or if there's something that we don't have that you want to bring on and you're just looking for it now, what is it that you found to be important?
For all of our patients on, hormone therapy, testosterone and estrogen, I love the supplement DIM for people to take every day. I love a good vitamin D supplement, an omega-3 supplement, a curcumin or a turmeric supplement.
We need to get that one.
Yes, we do. And we're right now going through kind of an overhaul of all our supplements. Methyl factors, so like B12, and then I love some of the antioxidants like we do some injections like B12, glutathione, and we're in the process of getting the IV therapy started.
Okay. So anything else on the weight loss medications or experience, or what that the client goes through or your patients go through, or even just setting it up? What have been some of the learning moments in getting this part of your practice going? I feel like I always have lots of those.
Yeah, learning moments. I mean, I think the biggest thing for us is just making sure the patient is educated on the side effects and making sure that, expectations are set, because a lot of people come in and they've heard all this great stuff. And if they don't lose any pounds in the first month, it's frustration. There's some people who lose 10 pounds in the first month, and there's some people who lose 1 pound in the first month. So I think educating people and just saying everybody and everybody is different. And so we will, this is a journey that we'll help you with. But, some people gain a lot up front on lower doses, and some people need higher doses. And we'll, walk through with you. There are some people who want to go, there's some patients who want to go up to higher doses, even if they're losing weight on the lower. And I think people are more likely to have side effects. So if people are having good weight loss and having some of those symptoms as far as like their appetite is being suppressed, then they don't need to be on higher doses. I think lower doses are always better.
Okay. So the other big piece of wellness that you've been doing for many years is bioidentical hormones. And so any advice to physicians that are looking to add this to their practice?
I think with hormone therapy, I think weight loss is a little bit easier to add. I think the weight loss piece is easier to add than the hormone therapy. I think with hormone therapy, you need a provider, whether it's a PA, nurse practitioner, or a physician that's well trained or already experienced. And so the biggest thing is training for that person, and then talking to clinics that are already doing it. And we're in the process of talking about setting up some education for clinics. A4M
I know you're all
is
shocked about that, this training program I love to develop. I'm going to bring Amy right into it.
Training programs for the hormone therapy.
Right.
So,
but you mentioned A4M.
A4M.
Let's go to that, because that's something that's set up, ready to go. You told me that it's pretty easy to access.
It
and
is
affordable.
It's affordable. It's a great training program. There are lots of different hormone therapy training programs within A4M. Some have to do with pellets, some don't have to do with pellets, but they have a great endocrinology module that you can go in and get trained on, and it's basic, it's online.
Mm-hmm.
You can go to courses also. One of our nurse practitioners just got back from Miami today from a training there this weekend, but it's a lot of it's online, and it's great information.
Yeah, I love that.
Mm-hmm.
The place to start, they can get started right away. And I think, it seems like what you told me in terms of, like, how much time do you think you spend on those online programs? How long are the courses?
It varies. They definitely take a few weeks to go through, and you can add modules on top of modules.
That's not a lot, though.
No, it's very reasonable.
Okay.
And there are some other companies that you can go and get thorough training also, but that you have to sign contracts with. And so I think people just have to have their eyes wide open and make sure they know what they're getting into with some of the other training companies.
Okay. Well, let's just kind of simplify, looking at these three buckets that we've talked about today, which is kind of the bucket of lasers, which is not about weight loss at all, but just, with women, and actually men too, but urinary incontinence and the Diva Emsella chat that we had, and then the weight loss chat that we had, and then we've only talked a little bit about hormones. But, looking at those three kind of buckets, what do you think was the simplest way to step into this world of wellness?
I think if someone is already an aesthetic center and their providers are good with lasers, I certainly think that the vaginal laser therapy and Emsella is an easy way to step in. I definitely also think the weight loss can be done fairly quickly. And so it kind of depends on what people are already doing. If they have a physician or mid-level, or their nurses are really experienced with lasers on the body, then I think getting some Diva training. If people are comfortable with the 2 wavelengths in Halo, and they get good, vaginal, you can learn. If people are dermatologists or at a derm clinic or do a lot of lasers, they can learn to do those exams. And so I think weight loss, I would say hormone is probably the most difficult piece.
Okay.
But certainly doable.
Hey, podcast family, Kat here. I hope you're loving the podcast and all the great info we are able to share. If you find this information helpful and want more, check out the Mint Aesthetics online e-courses. Developed by our 20-plus years of expertise in a $14 million med spa, the courses are truly designed by providers for providers. The catalog includes more than 30 courses ranging from topics like dermal fillers and body services to med spa marketing and equipment vetting. No matter your job title, your experience level, or your current book of business, these courses can help you grow as a professional and ultimately boost your revenue. Check out the e-courses online at mintaesthetics.com or give us a call at 913-338-2553. Hi, all. I hope you're enjoying the podcast. We are always looking for feedback to make it better. So be sure to give us your feedback at the link in the show notes. If you're loving the podcast, we would really appreciate it if you would share it with a friend, rate us 5 stars, and write a review. This really helps other clinics and industry professionals find our podcast. Thanks. Now let's get back to the episode. So, as a clinic owner, I also have to point out revenue.
Yes.
Like you look at how many come in for weight loss versus, we're silent over here because it's just like the number of clients, patients looking for weight loss is so much greater than what we have seen for vaginal rejuvenation with something like Diva.
Very true.
Or
and it's harder to talk about. If you're not used to talking about the vagina, it can be harder to talk about. And so for some, for plastic surgery practice, the provider, if you have an experienced provider who's worked in OBGYN or, is comfortable talking about the vagina, then that's easy. But there are a lot of, there are a lot of clinics that may not be the easiest place to start.
Right. I absolutely love it because, I just think that personally, I've experienced so much with it. And so I know so many that have. And to your point, every patient you've had has experienced results to some degree, which is amazing.
Right.
But if I look at the revenue piece and you're thinking, I can't do all three at once. Yeah. Okay, so hormones is a little trickier. There's more that goes into it. There's a lot more training with it. So maybe I don't start there. And then, I'm looking at this bucket of vaginal rejuvenation with laser devices or pelvic floor support with something like Emcella, or do I go into weight loss? I think weight loss
is a no-brainer.
No-brainer. Yeah. All right. Well, there you go, Dr. Carter. So you've had a lot of growth over the last while, and especially with the weight loss, you've brought on new team members all over, often, but definitely this past year.
We have.
How has that been going? Any words of wisdom with building your team?
It's been going great, and we're expanding locations too. Obviously, we're opening a Lenexa location on the Kansas side. So it's always that fine balance trying to add enough people but not add too many people all at once. And if you can train multiple people at once, that's ideal. So we have 3 nurse practitioners and myself, and then 3 support people, and we're going to add a full-time nurse doing IV therapy and then 1 more nurse practitioner. And so I think, for me, I can get busier or less busy based on the number of patients we have. Like I can back off a little and have some of the nurse practitioners see people a little bit more. So I think it's always kind of finding that balance. I know it's a little nerve-wracking for clinics hiring more mid-level providers or physicians because it costs a lot. And then trying to manage, can, RNs do some of this stuff? And technically in some states, RNs can put in pellet therapy. The provider just has to decide the dose. And so, there are lots that can go into the business part of deciding what can maximum ROI and what do people want to do.
The crazy thing is you haven't even marketed the weight loss. Like we couldn't really do any marketing because you got busy so
because
fast.
We got busy because
so
there are just too many people. So it's hiring to
be able
with
to
no
start marketing.
It's just word of mouth marketing, which is amazing. I mean that we're so busy doing that.
It happens that fast. I think too, the results of it are so
impressive,
and their friends are going to notice. Their family members are going to notice. It's impossible not to. And so then, of course, it's like, oh, what are you doing? You look great. And then, oh, I'm going to Dr. Carter.
Right.
So,
and what's been great, and I think it goes up. People come in for aesthetics, and they say, oh, you're doing weight loss, and then people come in, and they've lost a little weight, and they need some tightening, or they're so excited they've lost weight. They felt so self-conscious for so long, and now they're like, oh my gosh, I want to do a laser. I want to do, I want to do a halo. I want to do, and so we send them over. So it's they definitely the wellness components definitely increase people's aesthetic business and vice versa.
Absolutely.
Yeah.
Especially if you're newer on the aesthetic side and you don't have a big client base yet. If you brought in weight loss, you absolutely be bringing in new clients that then you could educate on, yes, do a referral program over to the aesthetics. Yes. I think it's such a great way to grow your aesthetic business as well, would be to add weight loss. Yeah, I love that. So anything about wellness that we haven't talked about that you want to share? Anything that maybe we talked about earlier that
I think we've covered most of it.
Okay. All right. Yeah. Well, I've got a couple more questions for you. We're
sure.
almost done, I swear.
Oh, no, we're
okay.
good.
So what do you do outside of work? What are your hobbies? What do you love to do? Yeah.
I always say someday I will have more time for myself. I kind of work too much. But I love traveling. So I love seeing new places and going to places I've already been and love. I do love my kids, and I do love my husband and my work. So
your kids,
I'm very
some pretty impressive activities.
Yes, horse shows,
yes, I love
and lots
it.
of sporting
yes.
events.
Yeah.
So I've got 3 kids, and
it's
my oldest is
soccer.
A senior.
It's horse shows.
It's horse shows. So which is fun. You got to go to Scottsdale to a horse show for a week. That's hard to beat. So I'm totally immersed in kids' activities right now, but. Yeah, someday I'll have a little more time to focus
and then also
on myself.
Hockey,
Exercise, hockey,
traveling,
baseball,
hockey team, baseball.
Yes. So lots of fun activities. Yeah.
I told Matt that this year, I think, as Jax has gotten older, I can just combine. I can find strength and conditioning workouts for him and me. I want to
do it together.
Yes, together or at the same gym at the same time, but maybe with different coaches. However, I'm going to work that out, but. I think that some of our passions can collide at the same time to happen at the same time so that I end up doing them more often.
Yeah.
So we'll see how
that goes. Yeah, my oldest and I have tried to do a little yoga together, but I feel like we're always going at different times. But on vacation, we've done it together a little bit.
I love that.
Yeah.
It's so fun. Any fun new trips coming up?
Fun trips. I have senior spring break next week. I almost said next year. Next week, senior spring break.
Kidding.
Not looking forward to it. Luck. Sorry, Riley. A little nerve-wracking with seniors.
Where are you going?
Cancun.
Oh, I did that one.
Yeah. You know how it was. Everyone was alive at the end of the trip, right?
Everyone was alive.
Everyone's alive. Mm-hmm. So that's the...
Yeah, we went the year of COVID. So by the time we were leaving the resort, there was 2 people there. We hit the Atlanta airport on the way home. It was a ghost town. It was the most eerie thing. So, but the beginning of it felt normal. And then it was just strange how as the week went on. It was what's going on? Mm-hmm. Oh, okay, this is getting serious. We got to get home.
We got to get home.
So I think yours will be much more fun.
Yeah,
but
hopefully not too fun.
But yeah, right.
Fun enough.
Fun enough. So is there anything that we missed on I sent you a whole bunch of fun questions that I probably we had so many things to talk about. I didn't stick to my questionnaire that I sent you. Is there anything else you want to talk about?
I mean, I think the biggest thing for weight loss is keep the dose low, make sure patients know side effects.
I love it.
Yeah, and keep the dose low as you can. I mean, as long as they're losing weight, keep the dose low and make sure they know about side effects.
And guess what?
And it's a great addition.
More to do a thorough job. Sorry, I had to get that out there. But do the consultation.
Yes.
Have the labs. Get the lab.
Absolutely.
Things.
Be thorough, and they'll appreciate it. And they'll appreciate it.
I mean, yes, absolutely, absolutely. So, well, thank you.
Yes. Thank
Amy,
you.
Thank you so much for coming onto the podcast.
Happy to come anytime.
I just loved every minute. We'll have to do a follow-up as you're building on and adding the IV therapy, and as we're building the 3rd location and opening it soon, and then as we're launching wellness into all of our cosmetic physician partners, the CPP group. Lots to come in the world of wellness.
Absolutely.
So, thanks for doing this.
I appreciate it. Thanks for your time.
All right. So thanks for spending the time with us today. We'll see you at the next episode of Making a Multimillion-Dollar Med Spa Podcast. I'm Kat Toronto. See you then. Thanks for tuning in to today's episode of the Making of a Multimillion-Dollar Med Spa Podcast. I'm Kat Toronto, and it's been an absolute joy to be part of your journey. Until next time, let your passion lead the way. See you soon.